Last week, Thomas Frieden, the CDC director, said there's no doubt that Zika causes microcephaly. And he said never before in history has there been a situation where a bite from a mosquito has resulted in such devastating malformation. I found that pretty astonishing. Never before in history. I wondered if you'd comment on that.
So there's two parts to that. So first there's the causal part that now the CDC feels comfortable coming out and saying Zika causes microcephaly. And I think that's because of a lot of just accruing evidence over time. Some of it showing the receptor now that's been identified, both in the placenta and in the developing fetal brain, which kind of promotes plausible, scientific hypotheses that can be tested. And then also just the growing number of microcephaly cases after these outbreaks. Now they've looked back at Micronesia and have seen that, and French Polynesia and so forth. So I think, is Zika the very first arbovirus that has ever, so that's mosquito-borne virus, that has ever caused a congenital malformation? So no, right? There have been other small case reports of, stillbirths and so forth caused by dengue, abortions caused by Rift Valley fever, maybe some congenital malformations caused by West Nile, plus minus. There have been other possibilities. Definitely Japanese encephalitis. There have been some cases in India and so forth, but I think not to this magnitude. So I think he's really talking about the magnitude of the outbreak right now that we're seeing. I mean, there are all of these women who are naive to this virus. They've never seen it before, so they're susceptible, and they've all gotten it at once. And so there's a huge outbreak going on right now. Over 2 million people have been infected, and a lot of them were pregnant women. And so we're seeing these devastating complications of this particular virus.
I'm curious of why in Micronesia, the Yap Island, 75% of the population, which is a huge number, 75% of the population was infected by the virus in the 70s, I believe.
2007.
2007, okay. Why didn't microcephaly become apparent then?
I think it's because, first of all, Yap is a small island in Micronesia. I think I don't know exactly, but I think that maybe there's only about 4,000 people or so that really live on that island. And so it was still quite a few number of people, right? 3,000 out of 4,000 maybe got infected. And so, microcephaly, although we're seeing tons and tons of cases now, Brazil, we're seeing about 4,000 cases in Brazil, but Brazil has a huge population, right? So I just don't think there were the numbers back then in Yap to really identify it. And there might not have also been like the registries, to actually, really be able to go back and look, okay, this is our normal number of microcephaly cases we have each year, and now there's been an uptick. There might not have been that information. But again, with such a low population and the fact that microcephaly is such a rare complication, it's probably a numbers game. It's probably down in the numbers.
It's interesting that in a few months we've gone from not much information, won't impact the U.S., won't impact America, nothing to worry about, no causal information about the transmission between the vector and the cause of microcephaly. And now we have all this wealth of information, the CDC confirming microcephaly and the causal relationship between. Have you seen anything propel this quickly?
I would have to say I am impressed by the amount of research that's coming up. Just me trying to keep up to date with the papers that are constantly coming out in New England Journal, Lancet, all of these, Cell, a lot of different really great journals. I think that the scientific community is really trying to do something to help out here, to give more information. I mean, this is a virus clearly that's causing a lot of devastation, and there are a lot of research gaps. And so I think it's fantastic that the scientific community is trying to get out as much information as they possibly can in a short time. That's actually really good information to try and educate all of us so we understand the risks, we understand the disease, and then we really know where we need to go next.
You mentioned the research gaps. What do you think are the most significant research gaps right now?
So, of course, I'm a little biased in this because I'm an epidemiologist. So I like to take things from the beginning. So I think one of the major gaps right now is we really don't fully understand the spectrum of disease of Zika and the rates by which this stuff is happening. So we still don't know. Do asymptomatic mothers who are infected, do they go on to have babies with cerebral malformations? We don't know that. How often does a mom who has Zika, who has who actually has the fever and the rash during pregnancy, how often do they actually go on to have a baby? So again, we don't fully have the denominator, so we don't know the rates. And then in a normal person, what is the full spectrum of disease? Are there things that we're missing? I'm a pediatrician, so I worry a lot about the young children. What if a baby who's 1 month old gets bitten by a mosquito and gets Zika? Are they going to have bad encephalitis or meningitis and have problems due to that? Are there other sequelae that we're missing from children being infected or older individuals? Are they more likely to have severe complications with Zika? What's the risk of Guillain-Barré syndrome? How often does that happen? What are the comorbidities that are related to that? Does it have something to do with, being prior exposed to dengue? There was a Lancet paper that suggests no, but there's still so many unanswered questions in just the epidemiology. And then, of course, we're learning more and more about the basic biology, which is going to strengthen drug development, diagnostics, and then a vaccine. I think those are probably the three main things. We need diagnosis close to the patient, field deployable diagnostics that can be done anywhere on the planet without a lot of resources, without power and things like that. So, and take it to the patient and make it rapid and make it accurate and make it specific so it doesn't cross-react with other known closely related viruses. And then we probably need a vaccine to sort of prevent this infection, in young children so that by the time they become pregnant, they're not at risk.
Why this sudden impact in large proportions? Zika the virus discovered in 1947 in Uganda, moves to Asia, moves to Micronesia, moves to South America. Why this sudden sort of flip into such a big, wide population? What are some of the ingredients that have really propelled that?
I would say a lot of the reason why we're seeing these huge resurgence in arboviral outbreaks. So this isn't just Zika, right? Chikungunya, there's 2 million cases in the Americas right now. There's an outbreak going on there that isn't being talked about. And dengue still is a problem everywhere. I think a lot of it has to do with sort of modern ways of living. We live in a very urban world, so there are a lot of people congregated in a lot of places. These vectors are emerging all throughout the tropics, and with climate change and weather events, they're extending where they can live. So I think that has something to do with it. And then the properties of this mosquito, this Aedes aegypti and Aedes albopictus mosquitoes, they are very hard to control. Aedes aegypti in particular loves to live in and around our habitats. It likes to be with humans, it likes to feed on us, it likes to breed in man-made containers in our backyard. And so it's sort of a perfect storm. We have these viruses that are constantly being introduced to new places because they come in commercial jetliners with people who are harboring the virus, and they show up in a place where this mosquito has run rampant, and so it can just bite the person who came off the plane, get virus, and start a little outbreak. And because we don't have really good control of these vectors right now, the outbreak spreads. And I think those are the main factors.
So what do you expect as we move into the summer months? You talked about this vector especially likes man-made places, a habitat. We're moving into humid summer months. How do you see this unfolding in the U.S. in the days ahead, months ahead?
So in the U.S., these mosquitoes, Aedes aegypti in particular is in the southeast U.S., although we do have it in California here. And then Aedes albopictus also has been notified in Southern California, and then all throughout the southeastern seaboard. And it goes all the way up into New York. And so we have the vector. And so what it will take is a lot of people coming in and importing cases of the virus and then getting bitten by these competent vectors on the ground to allow local transmission to take place. And using dengue or chikungunya as sort of case studies to try to predict what might happen with Zika, I can tell you that there have been locally transmitted dengue and chikungunya cases in Florida, which is sort of our Caribbean, right? And what generally has happened is someone imported the virus, they went to the Caribbean, visited somewhere in South America, came back to Florida, brought the virus with them, and then infected local populations of mosquitoes in Florida, and then there was a little outbreak. Now, luckily in the U.S., we have sort of a different lifestyle than many Central and South American countries when it comes to just exposure outside. We kind of like to be inside, watching TV, the air conditioner is on when it's hot outside, and so forth. And so I think our risk of having large-scale outbreaks here in the U.S. are pretty low. It's going to be what we've seen before with chicken dengue, with some sporadic transmission in Texas perhaps, or Florida. And I don't think it's going to be very widespread.
What's the risk in sexual transmission?
So again, another great epidemiological question that we don't have answered. So we know that that semen can have virus, and we know now that there have been sexually transmitted cases of Zika. Even before these outbreaks, there were possible cases, and now there's more and more of them confirmed by CDC and so forth. And I just think we don't know how long the virus stays in semen. We know it's not in the bloodstream very long. We know that it's in urine and saliva for about a month after acute onset of disease, but we don't know how long it is in semen. And so we don't know how long the risk period is for male to female transmission that way. But I can say, just looking at the Americas, I don't think sexual transmission is a very large part of the transmission that's going on right now. Most of it is due to the mosquito vector. And there is some portion that's due to sexual transmission, but I don't think it's a very large portion of overall transmission.
Why are we seemingly constantly caught off guard with these emerging viruses?
I think
Suddenly Zika
right.
propelled into the mainstream.
Right. I think that there's a couple reasons for that. First is, I'm an arbovirologist and I like to study these far-off infections. I work in Kenya. I study many infections that no one's heard of here at all, and probably many people don't care about. But I care
Chikungunya
about
for
them.
one.
Chikungunya. Well, chikungunya people should know and care about that one. I mean, we've had it in Florida, 2 million cases right now in the Americas, causing horrible joint problems that last years after infection. People should be paying attention to that one. People should be afraid of chick, I think. And I think the media should actually be paying a lot more attention to chick. But I study something like Rift Valley fever virus, which many people have never heard of. Can be incredibly devastating to animals and humans and cause very, very severe illness and death. One that we've never heard of. And so I think what happens is, there's all these infections. I'm an infectious disease specialist. It's an amazing field. There are many, many, many different types of infections, many, many different types of arboviruses all over the world that are sort of geographically distributed, but you need the specific vector to cause the disease. And so these things seem very far away. Just in far away places, something happening in Yap, how could that ever impact me or my family? It just seems so far away, but I think people really need to realize that it's a small world now. Things that are happening in Yap probably will affect you. It just is a matter of time. And I think we take sort of a very reactive approach. When the outbreaks happen, now we're going to do something about it. Well, if we had had a proactive approach and been paying attention to these viruses that are constantly emerging over time, maybe we could change the funding and maybe the media to put a little bit more highlight, a more proactive highlight on these things and just not talk about them after the outbreaks have actually happened. Because with mosquito-borne virus outbreaks, really in order to get the best bang for your buck, you need to be preventative. It's like pediatrics. It's all about prevention. You need to really prevent the outbreaks before the large-scale outbreaks happen, because by then it's too late, it's too hard to get a control of the vectors, too many people have gotten sick, too many healthcare costs and so forth. We really need to put more energy into preventing, predicting, understanding transmission, and doing vector surveillance, vector control. It doesn't sound very sexy, but it's the best thing we have right now.
Do you think that the $1.8 billion that the Obama administration is asking Congress for to fight, contain Zika, do you think that's enough?
That's a good question. Well, first, can I just say Obama's asked Congress, and Congress won't give it to him, which is shameful. And Congress needs to, stop playing these bipartisan games and actually do what's needed for this country and for the world. So I just want to say that. But $1.8 billion, it's a good start. It's more than Zika ever had in the past. Unfortunately, right now they're taking it away from Ebola money. And by the way, that Ebola emerging infections money, which was actually stolen from vector control and surveillance money. So, I think the U.S. right now, the economy is getting better. There isn't a lot of money to go around. NIH budget has been strapped for years and years. I wish that we could take more funding. We might have to take it from somewhere, defense, some really large budgets, and give a little bit more to science, a little bit more. I think a little bit more probably could go a longer way. But 1.8 billion, I would have to say, is an okay start.
Great.
I hope Congress approves it.
Thanks a lot, Desiree.
Thanks.